everyone, thanks for joining Law for Doctors today. Today we're going to be talking about an emerging field here in Las Vegas, so it's pretty exciting. We'll be talking about medical tourism. As I'm sure you know, Las Vegas is well known for its tourism, so we're hoping that the industry can kind of capitalize on that and see some growth in the medical field alongside with that too. So I have with us today Doug Geinzer. He's the CEO of Las Vegas Heals. Las Vegas Heals is, well, you probably do a better job of introducing it than I would. Why don't you just explain?
Sure. So Las Vegas Heals is an acronym for Healthcare, Education, Advocacy, and Leadership of Southern Nevada. It's the simplest term is we're almost a chamber of commerce for the healthcare industry. We represent a little over 22,000 healthcare professionals in Las Vegas. We're not a new group. We've been around since the year 2002, and we actually just went through a name change last year. Prior to that, we were known as the Southern Nevada Medical Industry Coalition. The mission has not changed. Our mission is all about how do we improve the quality of health here in Southern Nevada.
Yeah, and I know it has kind of a cool backstory. If I remember it correctly, is that the governor actually said we need to get something like this going.
So it was born after September 11th, 2001. Obviously, Las Vegas was hit harder than most other cities. And a lot of the economic developers got together and they said, how do we diversify the economy? How do we attract new industry to come to Las Vegas so we don't get impacted if another September 11th would happen? And everybody started talking, and what we realized, in order to attract companies to relocate or grow their businesses here, we needed to improve infrastructure, and that being healthcare, education, and some of the other lines. And a group of us stepped up and said, why don't we take on healthcare? Let's look at it as a cluster, which is an economic development term, and how do we bring the industry together to get to know one another and form strategic alliances so we could start growing the industry. And what started out as 11 people sitting around the table talking about it, again today amounts to a little over 22,000 folks that are part of Las Vegas Heals.
Yeah, and I know when you go to the meetings, there's all the heavy hitters there from the the 4 major hospitals, and just the big name people are there. So what kind of improvements have you seen since 2001 in the industry?
Sure. So we look at quality as really being driven by access. It's not that we have bad doctors. We have some of the most amazing doctors here in Las Vegas. But we have a challenge getting access to those doctors. And if you look at access, a lot of that is really controlled by workforce. So we don't have the adequate amount of registered nurses, PTs, OTs, and physicians to be able to provide care to a population of 2 million people. So some of our early successes with Las Vegas Heals, some of them were the doubling of the nursing program in the early 2000s. We realized that there was a nursing shortage, so we worked with the governor and the legislature to double the nursing program. In line with that, one of our more successful ones that you'll hear coming up in the upcoming months is the doubling of residency programs for physicians. We're grossly underslotted in residencies. So June of last year, we did, in our traditional sense, we started a conversation about graduate medical education and what would need to change to make that happen. We brought together all the CEOs and all the deans of the med schools, and we started a conversation. That conversation led to a commitment to continue meeting, and we met for about 9 months, came to a list of recommendations, and the governor appointed everybody that was on our task force to his task force. They brought forward those recommendations to the governor on June 15th, and it looks as if he will set aside some money in the upcoming biennium funding stream to expand graduate medical education. If all goes as well as planned, we will double the number of residencies in Nevada in less than 3 years, which is huge.
Yeah, and it's been cool. I maybe consider myself an outsider looking in at what the leadership in Heals is doing, and it's just cool to see everyone come together from the community and really try and do something that's going to make an impact. Yeah. Not for just now, but for.
So it wasn't always that easy. I could tell you lots of meetings back in the early part of the 2000s where very select few would show up at the table with arms crossed, a little bit concerned about what their colleague across the table was thinking. And today everybody comes together and they collaborate. We have task forces that focus on things such as workforce design, development, recruitment, retention, education, communications, legislative. We were very active with the Electronic Healthcare Records Initiative. We are very active with increasing Medicaid funding for the state of Nevada. Some of our issues today, we'll talk a little bit more about medical tourism. That's probably the biggest initiative that we're working on today after we concluded with the graduate medical education expansion.
So maybe just on to medical tourism, can you just maybe explain what that is if someone's not really sure?
Sure. So it is patients that are traveling to seek medical care. And really we could put those into two buckets, either an international patient or a domestic patient that's traveling to Las Vegas. Medical tourism is not new. It's been happening all around the world. Unfortunately, a lot of the American patients have been leaving the U.S. for low-cost care.
Right.
Our strategy has nothing to do with low-cost care. We're all about quality care. That's what we want to accomplish. And what we did is we took a look at the assets that we have here in Las Vegas. And frankly, there's no other city that's better positioned for medical tourism than Las Vegas. We have 41 million visitors a year that come to our destination. We have the best infrastructure from hotels and restaurants and dining and entertainment and the outdoors. And what we're finding is the centers of excellence wrapped around medical care. We're not going to be a transplant capital. That's just probably not going to happen in my lifetime, your lifetime. But what we will do is look at the service lines that go in alignment with the brand. And so our brand, Las Vegas, is all about anonymity. We do an amazing job of protecting privacy. And if you think about healthcare, it's a very private matter. People don't want others to know that they're going through treatment, that they're seeking treatment. So we look at those service lines that fit within that brand space. And what we found is we've got centers of excellence wrapped around weight management and bariatric care, brain health with the Cleveland Clinic that's here in town, cancer treatments with Comprehensive Cancer Centers of Nevada, fertility, and even things such as orthopedics and cardiac. So we've got some amazing providers, and what we're doing is we're starting to share that model with the rest of the world about how they could travel to Las Vegas for those types of care.
Mm-hmm. Where are people generally coming from? Is there like a target area of the world that?
So it depends if you're looking globally or domestically, and it also depends on the service line. So let's kind of take a look at domestic. There are markets around the United States that don't have specialists in them, and those folks do need to travel for care. And again, there's other things, the work that we're doing with clinical trials in Las Vegas, and we'll take a look at brain health and cancer treatments. Tremendous amount going around in clinical trials. That attracts patients to come here because that's where they could seek that higher level of care. Mm-hmm. Internationally, there are procedures that cannot be done legally overseas, whether that be in the Asia marketplace or the European marketplace, where those patients still want to seek care, and the only way for them to receive that type of care is to come here. If you were to identify a couple very large targets for us, Canada is one. They have some challenges up there. There are some very severe wait times to receive certain levels of care. Let's take a look at MRIs or CT scans. Sometimes there's a 4 to 6 month wait to get one of those. So imagine being that patient, going to see your primary care physician, and the doctor saying, yeah, you've got something going on down in this midsection, and something's bad.
Right.
Let's get you in for an MRI. What does your schedule look like in 5 months?
Yeah, hopefully I'm alive.
Yeah, so that's a problem that we could solve here in Las Vegas. Mm-hmm. So those are those areas. If you look at fertility, we have some of the best fertility doctors in the world practice right here. And if you ask them why, it's because they serve the Asian population, they serve the European population, and when folks from those countries have not been successful in getting pregnant, they seek out the best care, and all of those paths lead right here to Las Vegas.
Mm-hmm. Now, are there doctors here in Vegas that should be jumping on to the medical tourism bandwagon they don't know they should be? Or?
Absolutely. So I think several of them are already doing it. There's several that have built their practices around it. The concept of medical tourism has a lot of attention out there. Why? We've got this 41 million people that come to Las Vegas every year. And a lot of them come to Las Vegas every year at the same time for a medical meeting or a regular meeting or convention. If you look, Las Vegas is the meeting and convention capital of the world.
Yeah.
Last year we held over 21,000 meetings here. And those mid to upper level executives, those that have the type of insurance policy and have that health savings account that would allow them some level of travel, they're already coming here. So for them to be able to tie their care to a existing travel, whether that be through the form of an executive physical or whether that be through just general wellness programming, Las Vegas can offer that.
Mm-hmm. So is the initiative that you guys are doing now, are you looking to pull more doctors into the program, or are you looking more for marketing to the outside, bringing people into the doctors that are currently
So it's
available?
both. You know, in terms of getting the message out, there's a tremendous amount being done behind the scenes on that branding message. In terms of getting physicians prepared for this, we are putting together a series of educational lunches that will help those practitioners find out how they get involved in medical tourism. What does it look like? What does that self-insured employer look like? How do they get patients to come here? How do they provide concierge type services? What does it take to set up an international patient center? So these are all topics that we'll bring together, and we're bringing in world-known experts to help us out. Why? Because they're already coming here for meetings.
Right.
So again, we've got a lot of potential just because we're Las Vegas. And if you think about it, anything that Las Vegas has set its sights on, we usually hit. And we're confident that that will be true with medical tourism as well.
Yeah, you know, I know there was an old joke that says, you know, in Las Vegas, where's the best place to get your health care?
Yeah, stop saying that.
Right. Well, now, you know, I can see it. We're trying to reverse the joke.
That's
you
it.
know, that's where's the best place you get on an airplane and come here.
to McCarran. Absolutely. And that joke was probably, let's be real, that joke was probably true 20 years ago. Not so true 10 years ago. Today, you look around, we've got world-class doctors, some of the best from institutions from Georgetown to Stanford to Mayo. They all trained everywhere because they chose not to stay there to practice, and they chose a destination like Las Vegas. And imagine being a physician. You could practice wherever you want to practice. Imagine being able to practice in a city that offers 330 days of sunshine, world-class restaurants, shopping, entertainment, lower cost of living,
Lots of golf.
no rain, golf. You could travel anywhere that you want to in the world from Las Vegas. We have everything here. It's a perfect place to practice. And there is a message being put together for that that we'll be delivering out through the various medical meetings and conventions that are held here in Las Vegas to build up those ranks. Because just as earlier in the session here, we talked about the nursing shortage. We still have some levels of physician shortages. I could tell you in 3 years, we're going to have 4 med schools in Las Vegas.
Oh, wow.
That is huge.
Yeah.
And with the work that we've done with graduate medical education expansion, we'll see that pipeline start delivering highly qualified, homegrown talent in about 2021, 2022 is when we'll start seeing all of that infrastructure producing the way that we had hoped for it to produce. So now we've got a little bridge that we need to get in terms of attracting talent to relocate here to practice medicine.
Mm-hmm. I know I have, you handed me a copy of this strategic plan. I don't know if you can see the thing in the camera, but I know you're going to be going over this the next little while. Where can people learn more about what's happening, you know, in the near future?
Sure. The easiest way, if people go to our website, lasvegasheals.org, they could get in contact with us and we could share that strategic plan. To talk a little bit about the plan, we started this journey of can we become a destination for medical and wellness travel? And we started that journey a little over 3 years ago. We started the strategic planning process about 18 months ago. And during that process, we had about 147 healthcare professionals and organizations engaged and collaborating, which is a tremendous amount of folks and a lot of meetings and a lot of work.
I'm sure, yeah.
The 4 authoring organizations include UNLV, which has the best hospitality school in the world, Obviously, that goes hand in hand with medical tourism. We've got the Las Vegas Convention and Visitors Authority, which does two different things. They manage the brand for Las Vegas. So everything that is said about Las Vegas comes out of the LVCVA. And then they also manage the meetings that come into town. And that's a very big part of our strategy. The fact that we are now hosting more medical meetings than any other destination in the world, and we host more conventions as a whole than other conventions or other destinations. And then the other partner was the Las Vegas Global Economic Alliance. They're that regional development authority here in Las Vegas. And a lot of work needed to be done to get the alignment for medical tourism to become a reality. And it all started, oh gosh, probably 6 years ago when we were at the bottom of that recession and the governor commissioned the Brookings Institute and the SRI group to come in and do a study as to what can the state of Nevada do to diversify its economy. And healthcare services and medical tourism surfaced in that report. And then from that, it worked its way down into a regional plan, and now it's part of everybody's strategic plan in Las Vegas.
So what is the outlook like maybe in the next year or two? What do you see it looking like?
Right now, we'll start acting on the plan. You know, I'm a firm believer in plan the work the plan. So we'll be working on that plan right now in terms of deploying it, coming up with the tactical strategies. We have identified 4 meetings in the next quarter that we'll be attending and having a heavy presence at. We have partnered with a media company here in Las Vegas that will be taking our message and getting it out there to our target audience. That target audience are really the providers that make referral patterns coming into Las Vegas, as well as the insurance groups, both self-insured and commercial. So we've got our work cut out. The hard work is just beginning now.
Right. And it's always good to get involved if you want to get involved in medical tourism at the beginning, when things are, before they blossom and you're just becoming another player. You have an opportunity to get in the conversation now. I think, it'd be a good time to take it, so. Yeah,
it's a great time, and it's Las Vegas Heals is a membership-based organization. So we obviously are looking for more members. Those that have a desire in getting involved in medical tourism, we seem to be that lead agency out there, so we definitely encourage coming on board, joining the organization, and participating in the conversations that we're having around medical tourism, the lunch and learns that we will be providing, and some of the experts from all around the world that are going to be coming here to share their experience and what they know about medical tourism and what it will take for us to become the most globally recognized destination for medical and wellness travel.
Right, yeah, I'm sure we'll do it, so.
It's Las Vegas, that's what we do.
That's right. So where can we find your website again?
It's LasVegasHeals.org, and it's HEALS.org.
Perfect. All right, well, thanks everyone for tuning in. We hope to see you on our next episode.